Good afternoon, everyone. I am Jehan Acampong, and my case presentation is about pertussis or the whooping cough. So, shall we start? For our table of contents, first the overview of the Pedia disease, then the signs and symptoms, causes of the disease, risk factors and complications, then the prevention. We have the pertussis vaccination, then the medications or the drugs given, and lastly, the nursing care plan for the disease. We have the nursing assessment, nursing diagnosis, goals and desired outcome, nursing interventions, and evaluation. So first, let's define pertussis. Pertussis, also known as whooping cough, is a highly contagious respiratory disease. It is caused by the bacterium called Bordetella pertussis. Pertussis is known for uncontrollable, violent coughing, which often makes it hard to breathe. After cough fits, someone with pertussis often needs to take deep breaths, which result in a whooping sound. Pertussis can affect people of all ages, but can be very serious, even deadly for babies less than a year old. Whooping cough is a highly contagious respiratory tract infection. In many people, it's marked by a severe hacking cough, followed by a high-pitched intake of breath that sounds like whoop. So what are the symptoms of pertussis? Once you become infected with whooping cough, it takes about 7 to 10 days for signs and symptoms to appear. Though it can sometimes take longer, they usually mild at first and resemble those of a common cold. So we have the runny nose, nasal congestion, red and watery eyes, fever, and cough. After a week or two, signs and symptoms worsen. Thick mucus accumulates inside your airways, causing uncontrollable coughing. Severe and prolonged coughing attacks may provoke vomiting, result in a red or blue face, cause extreme fatigue, and with a high-pitched whoop sound during the next breath of air. However, many people don't develop the characteristics whoop. Sometimes a persistent hacking cough is the only sign that an adolescent or adult has whooping cough. Infants may not cough at all. Instead, they may struggle to breathe, or they may even temporarily stop breathing. So, what are the risks and complications? For the risk, teens and adults often recover from whooping cough with no problem. When the whooping cough vaccine you receive as a child eventually wears off, this leaves most teenagers and adults susceptible to the infection during an outbreak, and there continue to be regular outbreaks. For infants who are younger than age 12 months, who are unvaccinated or haven't received the full set of recommended vaccines, have the highest risk for severe complications and even death. For the complications occur. They tend to be side effects of the strenuous coughing, such as bruised or cracked ribs, abdominal hernias, broken blood vessels in the skin, or the whites of your eyes. In infants, especially those under 6 months of age, complications from whooping cough are more severe and may include pneumonia, slowed or stopped breathing, dehydration or weight loss due to feeding difficulties, seizures, and brain damage. And we also have prevention for the said disease. The best way to prevent whooping cough is with the pertussis vaccine, which doctors often give in combination with vaccines against 2 or other serious diseases, the diphtheria and tetanus. Doctors recommend beginning vaccination during infancy. The vaccine consists of a series of 5 injections, typically given to children at these ages. For 2 months old, 4 months old, then 6 months, 15 to 18 months, then last is 4 to 6 years old. So vaccine side effects. Side effects of the vaccine are usually mild and may include a fever, crankiness, headache, fatigue, or soreness at the site of the injection. Booster shots for adolescents. Because immunity from the pertussis vaccine tends to wane by age 11, doctors recommend the booster shot at the age to protect against whooping cough, diphtheria, and tetanus. For adults, some varieties of the every 10-year tetanus and diphtheria vaccine also include protection against whooping cough. This vaccine will also reduce the risk of your transmitting whooping cough to infants. And for pregnant women, health experts now recommend that pregnant women receive the pertussis vaccine between 27 and 36 weeks of gestation. This may also give some protection to the infant during the first few months of life. For the preventive medications, if you've been exposed to someone who has whooping cough, your doctor may recommend antibiotics to protect against infection. If you are a healthcare provider, are pregnant, are younger than age 12 months, have a health condition that could put you at risk of severe illness or complications such as weakened immune system or asthma, live with someone who has whooping cough, and if you live with someone who is at high risk of developing severe illness or complication from a whooping cough infection. For the medications and drugs, especially for the infants, macrolides erythromycin, clarithromycin, and azithromycin are preferred for the treatment of pertussis in persons 1 month of age and older. For infants younger than 1 month of age, macrolides should be used with caution as an association between orally administered erythromycin and azithromycin with infantile hypertrophic pyloric stenosis has been reported. However, azithromycin remains the drug of choice for treatment or prophylaxis of pertussis in very young infants because the risk of developing severe pertussis and life-threatening complication outweigh the potential risk of IHPS. So these are the macrolides agents and their frequency and the route of administration. This is specifically for the pediatric patients. So we have the azithromycin, clarithromycin, erythromycin, trimethoprim sulfamethoxazole, and the Septra. For the pharmacological management, antimicrobial agents given during the catarrhal phase may ameliorate the disease. You have the antibiotics and the vaccines inactivated bacterial. Active immunization increases resistance to infection. Vaccines consist of microorganisms or cellular components that act as antigens. For the nursing assessment, continuous assessment is necessary in order to know possible problems that may have led to concerns that may occur during nursing care. First, airway patency. Maintaining patent airway is always the first priority. Auscultation. Auscultate lungs for presence of normal or adventitious breath sounds. Next is respirations. Assess respirations. Note quality, rate, pattern, depth, flaring of nostrils, dyspnea or exertion, evidence of splinting, use of accessory muscles, and position for breathing. For our nursing diagnosis, based on the assessment data, the major nursing diagnoses are ineffective airway clearance related to copious and tenacious bronchial secretions, and impaired breathing pattern related to decreased airway patency. For our goals and desired outcome, the major nursing care planning goals for pertussis are patient will maintain clear, open airways as evidenced by normal breath sounds, normal rate and depth of respirations, and ability to effectively cough up secretions after treatments and deep breaths. Patient will demonstrate increased air exchange. Patient will classify methods to enhance secretion removal. Patient will recognize the significance of changes in sputum to include color, characteristics, amount, and odor. Last, patient will identify and avoid specific factors that inhibit effective airway clearance. For our nursing interventions, educate about coughing and breathing. Teach the patient the proper ways of coughing and breathing. Examples: take a deep breath, hold for 2 seconds, and cough 2 or 3 times in succession. Next, promote effective coughing. Educate the patient about optimal positioning, like sitting position, use of pillow or hand splints when coughing, use of abdominal muscles for more forceful cough, use of squat and huff techniques, use of incentive spirometry, and importance of ambulation and frequent position changes. Next, educate about proper positioning. Position the patient upright if tolerated. Regularly check the patient's position to prevent sliding down in bed. Encourage increase in oral fluid. Encourage patient to increase fluid intake to 3 liters per day within the limits of cardiac reserve and renal function. Next, administer medications as prescribed. Give medications as prescribed, such as antibiotics, mucolytic agents, bronchodilators, expectorants, noting effectiveness and side effects. And provide chest physiotherapy. Provide postural drainage, percussion, and vibration as ordered. And if our patient is, I would like also to emphasize, if our patient is one year old and less than, it is also important to help teaching the patient's SO or the patient's mother to for her also to have a proper in assessing her child or the infant. Evaluation goals are met as evidenced by patient maintained clear open airways as evidenced by normal breath sounds, normal rate and depth of respirations, and ability to effectively cough up secretions after treatments and deep breaths. Patient demonstrated increased air exchange. Patient classified methods to enhance secretion removal. Patient recognized the significance of changes in sputum to include color, character, amount, and odor, and patient identified and avoided specific factors that inhibit effective airway clearance. The normal vital signs and values for pediatric patients, especially infants, for the newborn to 1 month, heart rate 85 to 190 when awake. For the 1 month to 1 year, heart rate is 90 to 160 when awake. For the respiratory rate, 30 to 60 times per minute. For the temperature, 98.6 degrees Fahrenheit or 36.5 degrees Celsius. For the blood pressure, neonate 96 hours old to 1 month is 67 to 84 systolic blood pressure over 31 to 45 diastolic. So that's all. Thank you.